Formerly known as monkeypox, Mpox is a viral disease clinically related to smallpox. Symptoms are generally similar to the flu: fever, chills, and fatigue, often followed by distinctive lesions on the skin. It is generally spread through close physical contact, including sexual contact. A global outbreak in 2022 and 2023 mostly affected men who have sex with other men.
And there's multiple modes of transmission that we really need to better understand. Primarily what we are seeing is the contact type transmission. We have seen sexual transmission, which is really what is concerning us.
A new strain of Mpox known as Clade 1b is driving the current outbreak in Africa.
This is a more dangerous strain that was here in 2022-23. It's 10 times more dangerous in terms of deaths.
On Thursday, the U.S. National Institutes of Health announced that an antiviral drug developed to treat smallpox is not effective at treating Mpox, disappointing researchers here. Vaccines developed for smallpox provide some protection, but they're not widely available in Africa, and global supplies are limited.
There are multiple outbreaks that are happening. There are changes in terms of what we're seeing in the epidemiology itself. To understand that better will help us to use the limited numbers of vaccines that we have in a targeted and a most appropriate way.
In recent days, cases of Mpox have surfaced in Pakistan and Sweden. Public health officials say further global spread is likely, and many countries are bracing for the impact.
We are tracking closely on the spread of Mpox in Central Africa. We are pleased to see international leadership in this area.
While more cases are almost inevitable, researchers say Mpox is unlikely to become a global pandemic similar to COVID-19.
Luckily, this virus is not as contagious, so it doesn't spread as easily. However, I think some of the same principles apply. You have to go in, you have to educate people about the disease, about the symptoms, that they need to self-isolate if they have symptoms, to avoid spread to other people, to their loved ones.
The COVID-19 pandemic led many countries to beef up public health measures, including increased surveillance, contact tracing, and public communication efforts. Those lessons learned from COVID may help officials deal with Mpox. Jim Spellman, CGTN, Bethesda, Maryland.